Hey, Dr. Mom. All right, if pinworms just entered your house and you feel grossed out, overwhelmed, or like you did something wrong, take a deep breath. Whew. In this next few minutes, we're covering 3 things. What pinworms are and why they're so common. Okay, number 2, the fastest treatment plan I use and exactly how to prevent reinfection without losing your mind. All right, I'm Dr. Elana, pediatric naturopathic doctor, mama of 4, and the founder of Med School for Moms. I'm here to help you become a Dr. Mom, calm when illness hits, confident in your tools, and clear on what to do next. All right, real life story. Pinworms were not invited into our home, but they decided to show up during one of the worst times. All right, I was pregnant with baby number 3, and this medicine is not safe during pregnancy, and I knew how fast pinworms spread. And of course, as the mom, I was the one cleaning all the sheets, giving the kids baths, doing the laundry, wiping surfaces. I was exposed daily. Now, I do have a very active husband, but during that season in life, he was working many hours, and I was the lead for the kids while juggling work too. So I was exhausted, to say the least. And pinworms made it harder. So I'm really, really honest about this. There are times I lean on natural medicines, and there are times I go straight for the standard medicines. Now, for pinworms, I go right for the meds because they work, side effects are low, and you only need 1 to 2 doses and you're done. Now, I gave the medicine to 2 of my kids. I couldn't take the medicine myself because I was pregnant, and I gave another dose to my husband. Now, the whole family is recommended to take the medicine since spread happens fast. So yes, I get it. It's hard. It's not fun, and it's very common. But more than anything, it is not your fault. Please don't blame yourself. Okay, let's go into takeaway 1. Takeaway 1, pinworms are common, and most families can handle them from home. So first, the big reframe I want for you, Dr. Moms. Pinworms are the most common parasite found in children. They can easily be diagnosed and treated from home. And in fact, in our membership, we teach that pinworms are the only parasites that do not require a doctor visit, while so many others can. Now, there's a whole world of parasites and myths and fears around them, which is why inside Med School for Moms, we review the different types in depth in the Mastering Parasite section. But for today, we are keeping this focused and practical. Okay, here's the other piece that helps you feel less panicked. Pinworms spread fast, okay? Mostly through the hands, on surfaces. Kids itch. The eggs get underneath their fingernails, and then those eggs get into their mouth or onto surfaces. It just gets everywhere. Okay, this is why this can move through the house or through the school or daycare just so quickly. Now, reinfection happens also very easily. So maybe you treat, but then it's still in the nails on the surfaces. So I really want to just help you get that nipped in the butt. And it's not because you did something wrong if there was reinfection. It's because they're just highly contagious and they just move from kid to kid, okay? And kids are kids, so they're just going to get it everywhere. Okay, but takeaway 2, what's the fastest treatment plan? Plus, who is it for and who is it not for? So let's talk about treatment and effective treatment. I know many of you come here looking for natural options, and there's a time and a place for natural and conventional tools. Pinworms is one of those times when you may just want to use a conventional medicine, mostly because it's the fastest and most effective way just to get rid of them. It also significantly decreases that risk of reinfection for your whole family, so it cuts down the disinfecting marathon you're about to do. So conventional medicine, I recommend for this protocol, it's called Reese's Pinworm medicine. This is over the counter. You can find it at any just drugstore. But here are the key points I want you to remember. So I want you to get the family pack because each family member should be treated, okay? I also want you to remember it's safe for children over the age of 2 and in breastfeeding moms, but it's not safe if you're pregnant or children under 2 or less than 25 pounds. Okay, that's very important to remember. Now, there's 2 total doses. The first dose you give at initial signs and symptoms. Okay, so that's that itchy butt, and I'm gonna go through a big load of symptoms, but just immediately when you know it's there. And then that second dose is 2 weeks later because eggs can live for 1 or 2 weeks. So we really wanna make sure we're getting all of them. Now, quick note. Okay, this episode is educational. It's not medical advice. Please always talk with your doctor about what is right for your child, especially if you're pregnant, breastfeeding, or if your child's under 2 or under 25 pounds. Okay, now, takeaway 3, this is probably the most important one. It's about preventing reinfection with simple home routine, okay? This is the part that makes or breaks the outcome. Treatment matters, yes, but prevention matters just as much. So if you do only one thing after this episode, please do this trio: wash, hygiene, and cover. Okay, and I'm gonna go through details with all those 3. Okay, ready, wash. You're gonna wash all bedding, all the underwear, all the pajamas in hot water with detergent and vinegar. I'll go into more detail, but hygiene. Wash hands, right? Clean surfaces, wipe the kitchen, vacuum as much as you can. And then cover. Cover. Do not let kids run around or sleep naked to prevent spreading to others, okay? All right, let me give you some real, tangible, practical routines, okay? This is what helped me stay organized instead of frantic around things. So I just want to give you morning routine, daily routine, and evening routine. And please remember, this is for 5 to 7 days. I know it seems like a lot. The first 2 days are going to be the hardest, and then you kind of just like get in a flow and you're good to go for the rest of the time. And I promise you, it's gonna work. And then once it works and it's done, you're gonna just love it and you'll be done with it. And then you can feel like you mastered it. So let's go through the morning routine. All right, everyone wakes up. You're gonna strip the bed. You're gonna start a load of laundry right away while you throw the kids in the shower. So that's what you're gonna do. Just get the kids in the shower while you start organizing and getting all the laundry, okay? Now, eggs come out in the middle of the night. So the likelihood of eggs spreading first thing in the morning is very high. So first thing in the morning, you're gonna get kids naked, get them in the shower, strip their beds, throw their sheets in, their underwear, their PJs they wore, just right in the washing machine. And I recommend using hot water with detergent and vinegar to just kill those eggs. Okay, now your daily routine. It's like normal. Wash hands before eating, after using the bathroom. You want to frequently, disinfect cooking surfaces. You want to just like keep their bedrooms and their bathrooms as clean as possible, okay? Vacuum, dust, disinfect. Just do your best without losing your sanity. I promise this does get easier with time. This phase is worth it. Okay, so that's just like your day-to-day normal cleaning routine. Okay, now we're in the evening. So the evening, simple. Just don't let your kids sleep or run around the house naked. You know how our kids get. They want to be naked. They want to sit on the couch. They want to eat dinner naked. They just want to be free. And I get it and it's great, but not during this time because those eggs can come out and that's how they can spread. You want to cover their bum. Just cover them as much as possible. Okay. You also want to wear at least underwear, right, to reduce the spread. And here's a Dr. Mom pro tips. I've got a couple of pro tips for this protocol. So first, do this routine again. I mentioned this 5 to 7 days after starting treatment. Okay, so 5 to 7 days. You got this. I promise. The beginning's hard. It gets easier. Now, in rare cases, if pinworms are still seen, even after the 5 to 7 days and after the treatment, you're going to have to continue until all signs clear. And then you really know you got them. But it's rare. If you do this, you got it. But if you still see them, you got to keep on going. Okay, I love this little trick. Okay, I grabbed this non-petroleum jelly. Okay. Before bed, I like to take a little dollop of this. I like to just apply it to the anus. I usually wear gloves, especially when I was pregnant, I did, but you can choose. And then I put this right in their anus because when the eggs come out at night, they kind of get stuck in this gooey jelly instead of spreading everywhere. Now, this is not scientifically proven, but it has worked for my family and many families, and I love recommending it, right? So it's just something I do at night before bed. You don't have to do it. It's just like a little Dr. Mom little tip where I just place it right in their anus, and then in the morning when they hop in the shower, they're just gonna wipe it all off and everything's clean. So I like something like this. Okay, now I do also like giving a little bit of extra probiotic support in that department to just support the microbiome. Now again, Mama, I wanna say this. I know this was a lot, but I have this step by step inside the membership. I don't want you to feel like this is like a monumental task. It's totally normal to feel overwhelmed. It's a lot of laundry, a lot of cleaning when you're already so tired, so I get it. But it's just one step at a time, and I know you could do this. You got this. Now, I do want to make it clear when to call a doctor, okay? When can you not do this at home? So most cases are supported from home, not a problem, but when to reach for a doctor if you have any of the following, okay? If your child has just severe or persistent itching around the anus or even for girls around the vagina that does not improve after a few days of this home care, please call your doctor. Okay, if there's a lot of skin irritation or even an infection around the anus, including redness, swelling, oozing, or pain, give your doctor a call. If your child has abdominal pain, nausea, loss of appetite that just persists, visible worms, vaginal itching in girls, or just recurring infections even after appropriate treatment, definitely call your doctor. Something else is going on. This is not just an easy approach. You've got something else going on. Okay, it's time to recap. I hope you're not feeling too overwhelmed. Please, just so you know, you've got this. Okay, deep breaths. Okay, number one, pinworms. They are common and they are manageable at home. Please remember, it is not your fault. They spread. Almost every family gets this, if not a couple times. You've got this. It's okay. Number two, The fastest treatment plan is conventional medication, in my opinion, and the family is typically treated all together with 2 doses, 2 weeks apart, and clear safety limits. Remember, it's not appropriate for pregnancy or young children under 2 or under 25 pounds. Okay. Now, prevention is the game changer, right? We want to go through that wash, hygiene, cover routine. That's how to stop reinfection, right? Wash, hygiene, cover routine. Again, put this all, it's so step by step by step. We've got all of this inside the membership, but if you want really support, okay, if you're actually living through this, and this is exactly why I created Med School for Moms, because pinworms is one of those things that can make you feel isolated, okay? Isolated, overwhelmed, and honestly, just like a little embarrassed. Even though it's so common, so please don't be embarrassed. Now, you don't have to do this alone. Like, I cannot stress this enough. I promise, do not feel embarrassed. You'll see so many moms have this.